high blood pressure is not to be ignored. You ignore it at a risk to your life. A human being is said to have high blood pressure if continuously the systolic and the diastolic pressures exceed the limit of 140/90. Medical advice is necessary. Values higher than 160/95 are placed in the danger zone. Consult a physician and take medicine accordingly. However, changes in lifestyle can make all the difference in decreasing the severity of hypertension. Hypertension affects mostly people who are obese, children of parents either of whom might have suffered from hypertension, persons who use excessive quantities of salt, pickles, processed meat, canned soup, processed cheese, seasonings like tomato ketchup, soya sauce, chili sauce, and so on. Sodium in salts leads to excessive fluid retention in the body and thus increases the overall volume of blood which the heart has to pump. Certain users of birth control pills can also develop high blood pressure. Smokers are quite a target. Nicotine narrows and constricts arteries, thereby boosting the blood pressure. Persons who consume large amounts of alcohol are also prone to develop hypertension. Persons leading a stressful lifestyle, persons who are competing all the time with others and with themselves, unreasonably ambitious persons, mentally discontented, unforgiving, angry for no reason. Usually and unfortunately, hypertension has no symptoms. A periodical check is therefore necessary. However, in case the blood pressure is very high, the patient may suffer from headaches, blurry vision, or dizziness. There are other consequences such as partial or total blindness, swollen ankles, mental and body debility and fatigue. Left unchecked and untreated, hypertension leads to many undesirable consequences. Certain changes in lifestyle help deal with the hypertension quite well. Stop smoking. No medicine can help if you persist with smoking. Reduce alcohol intake, preferably give it up. Cut down salt intake. Reduce having papadam, sauces, pickles, and canned food. Very important, reduce weight. Reduce cholesterol with or without medication. Seek expert guidance. You just cannot ignore unhealthy cholesterol levels. Do not consume saturated fats. Control your diet. Be satisfied with smaller portions. A voracious appetite paves the way to a never-ending cycle of sickness. Do not forget to exercise regularly. Swim, cycle, stretch. Seek an expert's guidance on what to do and what to avoid in a gym. Join a support group or a circle of friends who meet regularly and care for each other. Another great advice is be happy. Relax. Relaxation has a positive effect in reducing hypertension. Stand and laugh for no reason. Meditate. It lowers blood pressure considerably. Use visualization for mental concentration. Practice yoga. and pranayam. Give up anger, jealousy, hatred, and negative feelings towards fellow human beings. The milk of human kindness is a tonic for the heart. Read books. It wonders, it widens your mind. And avoid movies and TV serials which show violence, horror, and scheming villains. Listen to Indian classical music, particularly the slow movements called alap. Remember, hypertension leads to a number of sicknesses. The arterial walls become thick and hardened, and there is no going back once the process has started and has reached an advanced stage. The smooth flow of blood is affected by narrow and inflexible arteries. The heart muscle comes under strain, it may give way and fail. Further, the supply of oxygen to the heart and the brain is reduced. This condition medically is known as atherosclerosis. Hypertension can lead to congestive heart failure if a substantial part of the heart muscle has been damaged. Blood collects in the extremities and in the lungs. It is not pumped efficiently. The heart is forced to pump against increasing resistance, and perforce it fails. A serious consequence of hypertension is stroke, which damages the brain, sometimes for good. High blood pressure makes it difficult for delicate blood vessels to function effectively. The brain does not get proper nourishment by way of blood and oxygen. Blood rushing with greater pressure than normal physically hurts the sensitive inner walls of the arteries. A deposit of plaque forms more rapidly than in the normal circumstances. The blood vessels lose their elasticity. As the plumbing becomes rotten, defective, inelastic, a sudden choking occurs. The patient suffers a stroke, which is sometimes fatal. So, take care of hypertension, change your lifestyle, and be happy. Thank you.